Hi, Ellis. I'm so glad you came in today. Now that you're in your second trimester, I wanted to make sure we spent a little bit of time talking about genetic screening and testing and what your options would be so that you could know what was available to you as you move forward in your pregnancy. Your family history, particularly if you have a mother or a father or a sister, brother, or a grandparent who has had any sort of genetic disorder, could put you at a higher risk of also having a genetic disorder or a condition. Being aware of that can help you know what your risk is of possibly passing something on to a baby. Age also can be a factor. For many doctors kind of feel like 35 years old is when your risk for some of the more common disorders that we know about, such as Down syndrome, become higher risk. That becomes a factor. You've not reached 35, so we won't put you into that risk category, but it is worthwhile to note that there are still quite a few Down syndrome babies born to parents who haven't reached that age. Um, if you had some people have what's called a translocation of DNA, which is just kind of a fancy way for saying they've had a condition within their DNA that doesn't show up in them, because their body has been able to make up for it, their other DNA has been able to make up for it. If you had that, you could actually pass that on to a baby. And you wouldn't necessarily know that you had that. If you look at your family history and you start to think about a specific condition in your family, you might notice that your parents don't have something, but your grandparents have something, or maybe you have a relative of your grandparents who have something, but your parents don't, or you don't. It could be that you have a recessive gene even for carrying something, and it's impossible to know the whole picture just based on what your family history states, but that can give you an indication that there could be something going on. Not all genetic conditions are inheritable. Some of them just happen, but many genetic conditions are inheritable. So again, you're in the second trimester, which means that you could do a lot of different testing at this point. You could opt to have an anatomy scan with an ultrasound and have your baby checked out from basically from head to toe. They're just going to look and see if there's any sort of anomaly. Other testing you could think about is getting a carrier screen. The carrier screen checks to see if you have any recessive genes within you that could be passed on to a baby. Other screening that's done at this point would be maternal serum screening, and this is it's a blood test, and it is able to measure whether you have a chance of having a child with an aneuploidy, which is a fancy, again, another term that means like a chromosomal change, such as Down syndrome or other chromosomal disorder. These also can have some soft markers for neural tube defects, which are like things like spina bifida or problems with brain development. Another testing that most providers are, not most, but many providers are choosing to do is called NIPS or NIPT, which means non-invasive prenatal testing or prenatal screening. This kind of test is, again, a blood test. And what it does is it looks for cells that are in your blood that are released from the placenta. These cells don't stay in your blood for very long. They're released from the placenta because they're going to die off, and your body has to eliminate them, so they end up in your bloodstream. So when this test is done, you take a blood sample, and those little placental cells are separated from your blood. And then when this testing is done, they're able to look at the chromosomal makeup of that, and they can test for actually quite a number of conditions and can give you a fairly decent accuracy of your potential chance of your baby having this disorder. So I'm going to give you a handout, and it would be great if you could read through this over the next couple of days. And if you want any of these tests, give me a call so that we can do a collection, like a blood sample, and send it into a lab. or so that I can call around to see if we can get you an ultrasound if you just want to wait until 18 weeks to get an ultrasound. A lot of people choose like more than one thing, and a lot of people choose to do nothing. So whatever you choose is totally okay. I will support you in whatever your decision is, but I need a call. So Ellis has called, and now we're doing our follow-up. So your screen came back positive, and your baby is at an increased risk of a trisomy. So a trisomy means that one of the chromosomes in your baby, instead of just being the 2 normal chromosomes, has a third. So in Down syndrome, it's the 21st chromosome. All the chromosomes are numbered. So in Down's, it's the 21st. There are other fairly well-known trisomy disorders. One is trisomy 18, also called Edwards syndrome, and another one is trisomy 13 called Patau. Again, this is a screening test, so it's really just showing you your accuracy, or it's showing you your risk of having this condition. So it's not diagnostic, it can't tell you for sure. So we need to think about some next steps of what you should and could want to do. You don't have to do anything with this result. You can just sit on it if you want. Another option would be to go ahead and schedule an anatomy scan. An anatomy scan would tell you if there are any major structural differences in your baby. So with a trisomy, typically they're going to look at the heart, and they're going to look at the brain. They're going to look at the abdomen, and they're going to see if there's anything majorly different. Now, an anatomy scan cannot give you necessarily a diagnostic result, but it can give you an idea of what your risk is. And you could take that information with the current test and then decide if you wanted to do a diagnostic test. The diagnostic tests that are available to you are chorionic villus sampling and amniocentesis. Actually, I misspoke there. The test available to you is amniocentesis. Chorionic villus sampling is typically done in the first trimester, but because you're in the second trimester, doctors are going to recommend amniocentesis. You would go to a maternal fetal medicine doctor, which is an OBGYN who specializes in high-risk pregnancies, and under an ultrasound, they would use a needle to take amniotic fluid out of your abdomen, and then they're going to test that to see specifically where the chromosomes are affected. So if your child has a trisomy, that is going to give you a definitive diagnosis so that you can be sure of what baby has. I think knowing sooner than later what your plan is going to be helpful for you, because then you'll kind of know where you're headed. But I want you to take some time and to discuss your options with your family to make a decision that's best for you. What you do with this information is very much contingent on you, your family, your values, and what's important to you. A lot of times what can be helpful for people with knowing more about the diagnosis is preparing for what the future with that baby could look like. If you're looking at an unfortunate outcome, it might change what you decide to do for the delivery of your baby. It may also determine whether, if you go into labor at 27 weeks, you know your baby has a deformity that's not compatible with life, we're not going to stop that labor from happening. We would allow that to continue because all the invasive procedures that would involve in trying to slow that kind of labor down. So it's a kind of a complicated decision that you need to make, but it is one that is best made sooner than later. So I will follow up by calling you in a few days just to see how you're doing. If you want to talk to a genetic counselor, I can give you the phone number for the place that you did your NIPS testing, and they can give you more details as to what your risks specifically are.